Thank you. Thanks a lot, Dr. Bassam, for being with us today and giving us this opportunity to have this conversation on diabetes and endocrinology.
You are more than welcome.
Doctor, the first question that I would like to ask you is like, when would a person visit an endocrinologist?
You know, there is a lot of situation that you need to see an endocrinologist. For example, if you have diabetes, if you suspect to have a diabetes, if you have in your family history of diabetes, your father, your mother, maybe this kind of situation you should see endocrinologist to find out if there is a diabetes, and if there is a diabetes to follow and treat to prevent all the complications of diabetes. And there is also a different kind of situation, like for example the thyroid problem. The thyroid gland is situated in the neck here, in the front of the neck, and sometimes it's the volume of the thyroid is enlarged, and sometimes there is a symptom that can direct us to diagnose disease in the secretion of the hormones, like hypersecretion or hyposecretion. Sometimes you have more hormone that you need, sometimes you have less hormone that we need, and each situation have different symptoms. For example, we know that thyroid problem have more prevalence in women, so the woman can suspect thyroid problem beside the size of the thyroid in the neck from some symptom. For example, if you have your weight changing, losing weight or gaining weight, sometime maybe due to hyper or hypothyroidism. If you have symptom in your sometime in the heart, sometime a patient go to cardiologist for palpitation, for example, and the cardiologist suspect excess of hormone that cause this kind of symptom. So this is about thyroid. Sometime for children, for example, everything related to growth of the children. For example, sometime you have a child and at school you find out that your children is not growing like all other kids. So you have to visit an endocrinologist to find out if there is problem in the hormone that give this short stature at this kid. And also you may have problem with the puberty. Sometime, for example, a kid, girl or boy, have problem with the puberty. Sometimes they have a sign of puberty arrive early. Some girl 6 year, 7 year old start to have breast enhancement in the volume, and this kind of situation should be followed by endocrinologist. I cannot give you the whole specialty. There is a lot of disease that we can treat. We can say that osteoporosis, for example, is the disease that should be treated by endocrinologist. Hyperlipidemia, hypercholesterolemia should be treated also by endocrinologist. Infertility in men and women, period disturbance, sometimes all those problems related to hormone. So sometimes the patient know that he must see endocrinologist, and sometimes he don't know, and the physician or the family practice can refer him to see a specialist for this kind of problem. Bahrain is a great country. Enjoy it and go out, do exercise. Don't go to restaurant all the time. There is different things to do, not only restaurants.